What is the deal with ear infections and what is the deal with ear tubes? Let's talk about it. Well, let's start with who gets ear infections. Generally, it is infants that get ear infections, ages 6 months to 12 months. This is the most common age. However, we can see it in much older kids. We can see it in certainly kids younger than 6 months as well. But it is very common in that age group because of the anatomy of an infant. As you can see in this schematic diagram, you can look at number one there with the X across it. That is the eustachian tube in the skull as it passes through the bones. It is extremely tiny, even in adults, but it's really extremely tiny in children and infants in particular. So that gets clogged up very easily. And that's number one on the diagram. Number two is the middle ear space where the pus accumulates, where the infection accumulates. And number three is the eardrum, which is what we see when we look through our otoscope down the child's ear canal. In the next photo, you can see actually what ear tubes do. Ear tubes are a workaround for a dysfunctional eustachian tube. As you can see in this diagram, you see the blue fluid draining out of the ear tube. That, I don't know why it's blue in the diagram, but it should be yellow because it's pus that's draining out of there and into your ear canal where it dries up and usually goes away. Now, let's think about ear infections in particular. As you can see in this diagram or this photo, on the left is a normal eardrum, very new looking, it's shiny, it's translucent and clear. The one on the right is a 10 out of 10. It's angry and bulging, meaning that's about as bad as you can get before the eardrum ruptures, which would be a beyond a 10. Thinking about that eardrum, let's think about how ear tubes are done, just so you're informed. In schematic picture number one, you can see the fluid behind the eardrum. It's straw colored, and it is fluid that has either come from an old ear infection that has gone away, kind of like ashes after a fire, or it could be fluid in the ear, middle ear space that is related to a cold and is going to turn into an ear infection. Frequently, we have kids that keep that fluid in there for months at a time, which is one of the reasons kids get ear tubes. So in number two, you can see a scalpel slicing into the eardrum, making a place for the ear tube to be put. In the old days, before I practiced, that was called a tympanocentesis and was actually a acceptable treatment for ear infections to get the pus out of the middle ear space. In picture number three, you can see a suction catheter suctioning out the thick and tenacious fluid out of the middle ear space through the eardrum. Oftentimes, it is as thick as glue. In picture number four, you can see the ear tube on the tips of a forceps, and they're about to put it into its final location. It goes in kind of like a button with a flange on the inside and the flange on the outside. I guess a cufflink might be a better description, but it can't go in and it can't come out, at least not for a while. And number five shows the ear tube in place. You can actually see through the ear tube into the middle ear space in that picture. That's a normally functioning ear tube. Now, let's think about ear tubes and facts about ear tubes. Obviously, the reason kids get ear tubes is because of poorly functioning eustachian tubes, which is a very, very common problem, especially in infants. But the main reason we want to do ear tubes, other than recurrent infections, is because these recurrent infections cause hearing and speech issues. If you don't do something about that fluid, the eardrum doesn't move appropriately, and children's hearing is affected, and eventually the speech is affected as well. The ear tube drains that middle ear fluid out of the middle ear space. So to do that, to have tubes placed, you have to be anesthetized. You have to be given anesthesia because we don't want the child to be moving at all because it's such a tiny place. Any movement would be a major problem. So anesthesia is required, but it is a very light anesthesia. The children are breathing on their own. They are not intubated with a tube down into their lungs, although the anesthesiologist will be around to do that if it were somehow necessary, but I've never had anybody have any kind of issue with anesthesia, and I have sent thousands and thousands of kids for ear tubes over the years, and I've never had one have either uh, a dangerous reaction to the anesthesia, or much less end up being intubated and having a more severe complication. Getting ear tubes is a very quick procedure. The procedure itself only takes about 5 minutes, but the pre-op and post-op time can take significantly longer than that. You usually have to be there at about 7 in the morning, and you will probably be leaving there by about 9:30 or 10. It takes about an hour for the anesthesia to wear off, and the child does frequently cry for about an hour after anesthesia as it wears off. Now, how long do tubes stay in? Tubes usually stay in about 2 years. Some kids get them and stay in even longer. If they stay in very long, say like 5 years or so, the ear, nose, and throat surgeon usually goes in and removes those surgically. That's not super common, but it does happen. Also, something that's not very common but does happen is ear tubes that don't stay in very long at all. Sometimes they'll just stay in for a month or two. And then oftentimes those kids need another set, as well as kids that even have ear tubes that stay in for a prolonged period of time, the normal 2 years. Sometimes they need a second set because as soon as their ear tubes fall out, they start having ear infections again. So their speech and hearing is affected again. Why infants? Well, we talked about that with the eustachian tube dysfunction. It is so tiny that it just gets clogged up super duper easily, just like a plumbing pipe at your house. The smaller it is, the more likely it is to get clogged up. Sometimes we just have a child that has just one infection that we just cannot seem to get rid of. We do multiple rounds of antibiotics. We even do Rocephin shots and clindamycin, antibiotics that we don't typically use on an everyday basis for regular infections, and we just can't get them to go away. So sometimes it is just one bad infection that we can't get rid of. A lot of parents want ear tubes even when it's not appropriate because they feel like their child has had too many ear infections. But if a child has infections every few months, that's actually okay as long as the middle ear space is cleared out between each infection. So 3 or 4 a year would be perfectly fine if they're normal in between episodes. It's obviously, after talking about all this, it's just not black and white usually of who needs ear tubes and who doesn't. Occasionally it is obvious, but a lot of times there's a judgment call that needs to be made based on the child's age, the time of year, the environment that the child's in. Is he about to get out of daycare? Is he about to go into daycare? Is it summertime? Is it wintertime? All of those factors factor in dramatically to whether you make the decision to get ear tubes or not. And all that being said, even adults can get ear tubes. So ear infections are common throughout all of human existence and human life, mainly in infants, but it can even be in adults. The biggest risk factor we have for ear infections and ear tubes is the effect of daycare. Daycare doubles your risk of ear infections and doubles your risk of ear tubes. 7% of the population in America will end up getting ear tubes in their first couple of years. And that's kids that are not in daycare. 15% of the children in daycare end up getting ear tubes. So that is a much higher number. So it doubles your risk. So daycare is a major factor into all of this. So that's the facts about ear infections and ear tubes. Ear infections are super common. We see them all the time. Obviously, your kids have had them, I'm sure. They're very common. We do not have lots of antibiotics like adults have that could treat ear infections, so we are limited, and we end up throwing in the towel after several ear infections, usually 2 to 3 weeks apart, and get ear tubes. But ear tubes are super quick to get. They are safe to have. They're very effective at returning hearing and speech to normal, and they're well tolerated. So it's a very good thing to do when it's appropriate. Sometimes there will be fluid that drains afterwards, and that can be problematic, but that's treated with antibiotics and eardrops, and the ENTs have some other things that they can do with suctioning out the infection as well. So that's the story about ear infections and ear tubes. Hopefully you have liked what I have put out, and please subscribe.